Thank you. When Cheryl called and asked me if I would do this, I was very honored, particularly since it's your last Wednesday on this earth. So I'm going to sit down. Well, when Cheryl asked me if I would do this, I assumed it was going to be a conversation. I don't know why I thought that, but I thought it was going to be a conversation. And I realized this morning when I got to work at about 7 o'clock in the morning, oh my God, should I have gotten something prepared? So I reached out to Cheryl and she said, no, you're fine. So she gave me some thoughts about what to talk about, which is pretty much what I had imagined. So I started out life, if you can call college starting out life, with a degree in political science, urban studies actually, from Tulane University in New Orleans. And I really felt like I had missed the most exciting time in American history in the 60s by being in New Orleans. And I came straight to New York, and I went up to the Columbia campus. I was going to get a PhD in political science, urban studies, and the campus was on strike. And New Orleans to Columbia campus was a big leap. I came back down to my apartment and decided to get a job instead, because I realized I didn't want to teach, I didn't want to write, and I didn't know what I was going to do with a degree in political science. And I felt like I really wanted to do something that would make a difference, and I didn't feel it was going to be through either of those two things. So I got a job, and I worked as a gopher, Girl Friday kind of, that's what they called it in the day, for a couple of years. And I ended up, my last job was in a design firm, and I was really intrigued. Because these people, while they weren't doing what I wanted to do, I recognized that they had skills and abilities that could be put to good use. And I applied to Parsons School of Design. And Parsons School of Design had a degree at that moment called environmental design, which I didn't know what that was, but it sounded close to what I thought I wanted to do. And I applied, and I had never taken a creative course of anything in my entire life. And my mother said when I applied, she said, I gave you dance lessons. I gave you violin lessons. I never thought to give you art lessons. How come you decided to become a designer? And I didn't have any idea what I was doing, but I had some instinct that designers could do things that I wanted to do. So I went to Parsons 3 full-time years because I got a few credits for my liberal arts stuff, but I went back to the beginning. And my second year in Parsons, Educational Facilities Lab, which was a part of the Ford Foundation, brought a group together at Parsons to redesign high schools in New York. And we won this grant, and I ended up spending the next 7 years working in New York City public schools and in public schools around the area in neighborhoods of all kinds, mostly neighborhoods where they felt that kids would be empowered by learning how to think like a designer, and they would learn how to do math and read using design as a tool to rebuild their schools, redesign and rebuild their schools. So I did that for a number of years and ended up starting the Architect in Schools program with a national endowment through that work. It was incredibly gratifying. It was advocacy planning, and so all my instincts toward urban design were kind of realized in being able to actually go in and make a difference in neighborhoods. And most of my work was in the South Bronx in New York City, and a little bit in Bed-Stuy, Brownsville, and so on. So 5 years into it, we couldn't raise any money for it anymore because, I don't know how many of you have been through the grant thing. I know Cheryl has. Things run in waves. And they finally decide, well, we did that for 5 years, and now we don't need to do that anymore. If they're not doing it on their own, let's go. They moved on to other things. And my partner, Michael, and I was doing a little bit of design work. He had just come out of a small design firm that where he had started it with Massimo and Leila Vignelli. I don't know if any of you know who they are, but he was the first person. They brought him along with them to start Vignelli Associates. So Michael and Massimo and Leila were working, and he had decided the office was now about 5 people. He was ready to go off on his own. So he was starting in his thing. We were together. I was doing my thing, commuting to 149th and St. Anne's every day, and working for him on the side. And at the end of that period of time, I was getting rather intrigued with the kinds of stuff he was doing, because he was he had some amazing projects. He was working with the Eameses, Charles and Ray Eames, on exhibits for IBM. We were doing a lot of information design, museum exhibitions. We worked on a mapping program for SLT, the mapping company for kids and teachers. So we were doing some very exciting kind of information design projects, and I decided that I would be happy with that. So we started Nancye Green in earnest, and this was in the late 70s, and by 1995, let's say, we had 100 people, and we were doing a lot of very interesting work. We'd come up with the concept for American Girl Place. It was a catalog company, and I had done some market research through their call center with girls, and realized that they could probably get a lot of people to come to a destination experience if we could design one that made sense. And so that's what we did, and it opened, and it was very successful. In the process, we also designed the Reagan Library, which was a very interesting project, because when we got the call asking if we'd be interested in it, I thought it was a joke. I mean, I've heard other people say stories like this, but it was like one of my Democratic friends calling to pull my chain or something. Would you like to design the Reagan Library? Yeah, sure, right. Well, it turns out that Nancy Reagan had seen a museum we designed in Salem, Massachusetts, and she loved the sensibility of it. And so she said, go call those people. And they had already hired and fired a few people, so by that time they were desperate. So they hired us on the spot, and we ended up actually working with President and Mrs. Reagan for 18 months designing the library and then building it. So that was challenging, to come back to my office and say, anyone who wants to work on the Reagan Library, you're in. If you don't want to, you don't have to. And it's interesting, designing a presidential library is a very special experience, not because you always love the politics of the president. I wasn't a Reagan supporter or fan, but there's something about the presidency and about the institution of the presidency and about telling a presidential story that is pretty fascinating. And of course, it got very interesting when we talked about Iran-Contra, and I was able to spend a lot of time with his biographer. And it was a great experience, just in a designer really being able to do something that got us involved in thinking about history and about times that we'd lived through. So we did that. A lot of things were rattled off, but among some of the more interesting things we've done is my first big assignment with Nancye Green back in 1978 was doing a technology symposium for Exxon, research and engineering, really looking at leading edge technologies that were not fossil fuel technologies and taking that around the world and really writing the speeches, the stories, and animating the science and working with scientists. So, I've always had, Michael also has had always a deep love of information and information design and dealing with content and shaping it. So that's a lot of what we did over the years, whether it was for GM or P&G, where we did a lot of work on customer experience. A lot of it was just looking at systems and patterns and thinking about kind of big ideas and how you shape experience. So in 2000, we left Nancye Green. We'd sold it. The company that we sold it to, which we liked a lot, it was a Silicon Valley agency were three Apple guys who had left and started this agency, had run aground, and they were bought by somebody who was bought by somebody else, and by then the whole thing was just ridiculous. And when the third owner walked in, and he was this guy in a plastic suit, and he was just hair slicked back, and he had done a lot of back-end engineering of systems and said, consulting, that's so easy. What do you have to know, right? So we knew that it was going to be a short rope, and at the end of our contract, they fired us, and we were happy to leave. And at that point, we were not expecting that, and we had, 2000. We walked out of there. We got a 2-week notice. We walked out, and 2 weeks later, and we had nothing to do. So that was a really interesting moment where we both sat back and said, so what would we like to do? And we started looking at things that were interesting to us. So we started a couple of companies, one of them called CO2 Responsible, where people who own cars could learn about how to manage their fossil fuel lives and their energy lives in better ways by going online and actually buying carbon credits was part of it, but it was also trying to use that as a doorway into lots of other understanding of how you use energy in your life. It didn't work. And then we started another company called Asphalt Media that really used trucks, which were already on the highways, as a communication platform, which made a lot of sense to us because it was inexpensive. They were there anyway. And you could actually, because all the highways are monitored, you could actually create a measured media out of it, and no one had done that. So we figured out how to do that. That didn't work. And then in the process of that, I was on a number of boards and got invited onto the board of Waterworks, which is a fancy bathroom company. And when it was sold to a private investment firm, they asked me if I'd be CEO. And I'd always wanted to be CEO of a company. I thought that would be interesting. Because as designers, we always work with CEOs, right? And you always think, oh, I could do that. I mean, look, we're making that guy successful. I could be successful. And I tried it, and it was really hard. I mean, I really didn't understand how hard it is to actually be the only person you can turn to, you know, in the morning in the bathroom mirror and say, should we do that? I don't know, should we? You know, it's a very risk-filled and scary place to be, because you're dealing with other people's money and you're trying to make good decisions, and the decisions are on every front. It's not just product development or, you know, as designers, we deal with some part of what the companies who hire us deal with. Well, here you're dealing with everything. And you know, it was complicated and difficult, and I did it, and we sold the company. And by the way, my last year was in the biggest recession for the home furnishings business that the home furnishings business had ever seen. So it was really challenging. But it was also, I learned a lot, and I decided that I was really happy not being a CEO. And about the time I left Waterworks, I got a phone call from a man by the name of Clive Meanwell. He's a MD, PhD. He's an Englishman who was the managing partner at Hoffman LaRoche, the big pharmaceutical company. And in the 1990s, Richard Werman, who you may know from, he founded the TED conferences, and I had done a very big expert system for Hoffman LaRoche. And what we'd done was look at drug development, which at that time took about 15 years and cost about $500 million. And they were saying, how can we make it less expensive? And one of the ways that Bain Consulting told them they could make it less expensive was create a real information architecture whereby you really knew, this is before computers on every desktop, by the way, where you could categorize and track the knowledge you gained from the beginning all the way through the end for 15 years. And so we figured out how to design that architecture, and we implemented it for Roche. And this guy was incredibly successful, and he was very happy. And so 10 years later or so, he called me and said, I have this little startup pharmaceutical biotech company, and I'm bringing a whole bunch of drugs to market, and I need everything. I need to think about how all these brands become connected, because they were all hospital products. I need to think about the culture of this place and how I get everybody on the same page. I need to think about customers and patients and how I deliver experiences. And I need to think about how I can differentiate my values and purpose and mission from the pharmaceutical industry, which is really corrupt and broken, because he had this idea that he could develop drugs less expensively and deliver them, therefore, to patients less expensively, and therefore get really powerful drugs to market that patients could afford. So, and the health system could afford. So he had this big dream, and he felt he needed a designer by his side. So I went to work with them as a joint venture with Nancye Green in 2008 and or so. And in about 2012, by then I was working full-time, and we had a team working pretty much full-time for the medicines company, doing everything from originally the branding and the culture stuff, and then moving on into what I'm doing now, which is that he had a lot of drugs that he had licensed and was bringing to market, and along the way licensed an extraordinarily big drug, a blockbuster drug, that could affect the lives of everybody in the world who's suffering from cardiovascular disease, and decided that he would sell off almost everything in order to be able to bring this drug to market. And so my job now is I am the I don't know what the title is, the communication, collaboration, patient experience, caregiver experience designer person who's really looking at design from every single angle and figuring out how to help build this very large coalition of partners because we're a small company. So we've hired someone to do the research, the clinical trials, and that will be about 1,000 people. We, at our end, will be about 80 people, and we'll have probably 20, 30 other companies involved going all the way through manufacturing. And we have to figure out how to build this coalition so that they know that when we say we're doing things differently, we're doing things differently, meaning we have to create the most efficient path to development so that we can actually bring this drug out for as little price, for the smallest price tag possible, so that everyone who could suffer from cardiovascular disease due to high cholesterol, which is most people, can actually have access to this drug. Then we have to convince the health system, which is really payers, that is the government, your insurance companies, to pay for it. And we have to convince doctors that this is the best way to help your patients, and then patients to adhere to the process. And our drug, which is really interesting because most drugs that people take for this, they have to take every day. Ours will be a shot once or twice a year. So that's great because people don't have, it's like almost like a vaccine, but they have to come back and take it once or twice a year, because if they miss one shot, then all the work they did to protect themselves is gone. So we have everything from adherence and human behavior issues. So one of the things I'm looking at now is looking for people to bring in, smart people who are designer type people, to bring in to look at how do you segment the behavior types of patients, sound familiar, so that you can figure out why patients do and don't do what they should do to make themselves healthier. And that's true of all sorts of things we want people to do, whether it's consume energy in a better way. I mean, all the things we've been trying to look at as a company all these years, starting even looking back in the 90s at P&G and saying, how do we get people, consumers, to use our product? We have to look at their behaviors, and we have to not try to change their behavior, but try to sort of lean into their behaviors and figure out how their behaviors can really be more positive for themselves. In this case, really positive for themselves. And so it's very exciting. And I would say about design and designers, whoever said in the introduction that Debbie said, I mean, I think one of the powerful things that designers know how to do is really think about how to structure the problem. We don't always know what the answer is, but what we can do is figure out how to structure the problem and how to get other smart people kind of in the boat with us, so that, and these problems are big and they're intractable. One thing that's really interesting to me when I started looking at literature on adherence. Now, if you think about the fact, I'll tell you a little story first. Procter & Gamble invented the concept that you have to put 2 applications of shampoo on your hair. You know, rinse and repeat. Some marketing person came up with that, so you would use twice as much shampoo. You actually don't need to do that, but you do use twice as much shampoo when you do it. And so what they were actually doing was pretty smart, right? I mean, they were leaning into a human behavior which says, well, if my hair is going to be dirty, I'm going to do it one more time. When you think about the kinds of things that we try to do as designers, we try to figure out, you know, what's going to motivate people to do something. And I think what's exciting about what I think the big intractable problems are is that they require lots of different kinds of people with lots of different kinds of understanding of lots of different kinds of things to get around the table and to bring the problem out to the biggest way to look at it, and then bring the problem back to thinking about how can we chunk it so that we can divide the problem into a series of problems we can actually solve. And then how do we put the thing all back together again so that we have one big solution that we can, that's complex probably, but that we can actually do. Because, you know, our big problem in our healthcare world, and the problem I'm trying to solve now, is that payers don't want to pay for anything. You know, if any of you have insurance, health insurance, you know that you have to fight for everything. They don't want to do anything that they don't have to. if any of you have maybe, hopefully you haven't had to follow this for personal reasons, but when this very expensive new hepatitis C drug came out that was something like $64,000 a year that many, many, many people could use, payers basically said, we're not going to pay for it, because if everybody who needed it could get it, we would be bankrupt. Well, it's the same thing with the drug I'm talking about. If everybody who needed it, so I'll give you an example. Someone who's had a heart attack and has high bad cholesterol could use this drug, and they're the most likely to get it. There are also people who are born with high cholesterol, and those people often die. I hope no one in the room has homozygous hypercholesteremia, but what that is you're born with, and there are very few people that have it, you're born with very high bad cholesterol at birth, and most of those people don't survive teenage years or maybe early 20s. So if you could solve that for them, that's fantastic. And insurance companies will probably let us sell the drug to them, and they'll probably pay for it. But if you have high cholesterol and you're 16 or 20 or 40, then you will eventually have acute cardiovascular disease. You just will. I mean, there's just no doubt about it. And you'll probably die of heart disease if you live all your life or most of your life with high LDL. If you could get a shot once a year and you don't have to live with high LDL, then you'll never have heart disease. You'll die of something, but you won't die of heart disease. If you think about the fact that it's the biggest killer of people and that 80% of it could be prevented with this, you think, well, I want as many people to have it as possible, and therefore and payers will say, I want as few people to have it as possible because I don't want to pay for it. So, in terms of the complexity of the problem, my part of the problem is trying to figure out how to get people to take it. Someone else's part of the problem on my team is to figure out how do I convince payers that it has value, that at the end of the day, if these people don't get cardiovascular disease, they'll be healthier to the end of life, and therefore you won't have to pay for all these other things you have to do for them. The healthcare provider comes back and says, but I only get them for 3 years anyway, so why do I care? And we come back and say, well, then we better find a healthcare system that has a locked-in population. So we're looking for healthcare systems that have locked-in populations to be our partners. So every part of the problem is a problem to be solved. And I think in the kinds of things I know you want to do, or you wouldn't be here, you'll be dealing as designers with both the capability of taking apart these problems and hopefully being the other smart person in the room with lots of other smart people who are looking at parts of the problem. And you'll be able to solve one part of it, and you'll be able to put the whole thing back together again and figure out how to do something that lots of people will buy in the biggest sense of the word. Whether it's not doing something, convincing people not to do something, convincing people to do something smarter. There are so many things we need to do in the world that it's just a matter of going out there and finding a situation in which you can do it. So, any thoughts? Questions? I mean, I can answer any kinds of questions that... Yes?
You mentioned earlier that when you became a CEO for the first time, that it was really hard. Can you give us an example of
yes.
that, like if you could go back to like, I would know how to solve this or tackle this?
Yes. So I got a coach right when I decided to take this job. I got a coach, and I remember the day she said to me, it rings in my head so many times. She said, "You're a very creative person. You have a lot of ideas. You have to stop." Right? Because you have to come up with the plan, and then you have to say it over and over and over again, and you can't go off the track, because you may see another thing you could do, but you can't do that thing, because you're in a situation where people are trying to figure out how to do something that's difficult. They're trying to close down the options. They're trying to say, focus on what to do to get from here to there. And creative people have a tendency to want to come up with even better ideas, because you get here with an idea and you see now, oh, I learned something here. Really, this is a shiny object over here, right? And so I'm going to turn, but at some point you have to say, stop. We made this plan, and even if it's not a perfect plan, it's probably the right plan or the best plan, and I can't have all these other 200 people saying, now she's doing this. And how many of us have worked with people that can't close down options because either they're afraid of the one they picked wasn't good enough because they're insecure. And I felt like I was always insecure. Like, did I explore every single possibility and pick the absolute best option? And I would get 2 months down the road and say, well, I can see that this may be, look at all these obstacles, right? Well, she was so smart because she said, just barge through the obstacles because you can't change your mind now, right? And I think this notion of when you want a large group of people to move in a direction, you have to be relentless about staying the course. And I think that's very hard. You see it in presidents, you see it in, of all sorts of things, including our country. You see it in all sorts of people who lead. That, you know, the ones who you get tired of are the ones who have, like, they're one-trick ponies. But a lot of times, they're the ones who, for better or worse, effectively can get something done. And I think somewhere in the middle is the truth, is that you have to really make your best judgment and you have to stay with the plan. So for me, I found being a creative person and not having all that responsibility to keep second guessing myself. Did I make the best choice? Am I serving the investors? Am I serving the customers? Am I serving? I just would drive myself crazy. And you know, I watched the CEO that brought me into the medicines company, and there have been incredibly dark days of all kinds, you know, with his board on his back and Wall Street on his back, and, you know, did I make the, he bought all these assets when we were a hospital medicine company. One of them turned out to be extraordinary, and so then he turned around and decided to sell them all. I mean, this is not for sissies. I mean, he had to keep taking the phone calls all weekend long in the middle of the night from his board saying, what? You want me to sell that? We just bought it 3 years ago, right? So it's all that kind of stuff. Yes?
So you previously spoke about when you were building or designing the presidential library from Reagan. I kind of want to know a little bit more about what it was like to design for something that you completely disagree with or don't feel like is in line with your own values.
Well, it's interesting because that's a very good question. I mean, if you've ever been to a presidential library, a lot of it is not particularly political. Parts of it are. You tell the story of his childhood, etc. It was interesting because I was very critical of his domestic policy, his economic policy, a lot of things. But what I found when I was doing the library is that a lot of it was the telling of the story. Of the only thing that I actually put my foot down on was, and by the way, his chief of staff agreed with me and we both did it together, was his people tried to rewrite his position on HIV, which was not rewritable. And that was like, we're not going there. You can not mention it if you don't want to, but we're not going to tell that story the way you want to tell it because it's just not true. And the part of Iran-Contra and a lot of that stuff was a timeline. So I never felt particularly compromised, you know, the gifts to the president. We did an interact, and the one thing I have to say that does happen whenever you meet someone of that caliber is that you get to know them and you get to appreciate their perspective. I don't mean agree with it, but you start to understand them in the context of their own lives and their own thinking, and it changes your empathy. You know, it's much easier to be very pissed off at somebody who you don't actually know. And I don't know if you've had this experience. I've had it a lot. I've had it a lot when I was working in the South Bronx because there was a lot of fighting to do with really dumb Board of Education people, and who did or didn't want to do, who wanted to do something we didn't want to do, or didn't want to do something we did want to do, and a lot of unenlightened people in the process. And what you find is if you sit down with them, I did a lot of conflict resolution training in that situation because I was working through the New York Urban Coalition, and they rightly made us do it. But I really found that if you sat down with someone and you talked with them and you understood their perspective and their own background and where they came from, it was a lot easier to sort of not necessarily agree, but at least accept that their position was a position that you could respect. And I think that working with Ronald Reagan, I learned a lot about him as a human being. I read all of his high school book reports in order to pick the one that would go in the library. I read all of his letters back and forth to Gorbachev when he was in the hospital that went behind and around the CIA. I mean, I got a chance to actually get to know him and what he valued. And he had huge blind spots. But what he believed in made a lot of other things possible. So I kind of, I really focused on, he made a lot of countries more liberal, more free. He got a lot of people out of prison. There were things he did that were positive, and then there was the other stuff that, I never had to say anything or do anything I didn't believe in. Let's put it that way. But, I grew up in the Army. My father was an Army general, and I grew up partly in Washington, and he was in the Joint Chiefs of Staff's office. So I'm probably a little bit easier to persuade over to the side of respecting anyone who's got the job of President of the United States. I have a huge reverence for the office, if not for the person in it, which is what makes it even more disgusting when you don't believe in the way they're acting. But I do believe that Ronald Reagan was a patriot, and I could get into that part of him, and I believe he wasn't a person without values. He was a person with values, he just had blind spots. So, it was possible. It's interesting because a lot of people in my office who initially said no basically came up and said, well, that would be kind of interesting. Maybe you'll, let us work on it. So. Yes?
I'm always really interested in partners who are both partners in life and partners in collaboration design services. Would you talk a little bit about what it's like to be married to the person that you work with and what that relationship's like and what you've learned about what it means to collaborate?
Well, I think that a collaboration in a partnership like this, like a collaboration in a marriage, you have to share the same values. If you don't have some sort of foundational baseline, you have to share a sense of humor. You have to share. You like the same foods. I mean, whatever it is, there have to be. You love cooking. You love eating. You love drinking wine. You love whatever. You love traveling. Whatever it is, there's got to be something that really brings you together. Michael and I never agreed about design stuff, which is really interesting that we ended up as partners, because we shared so much of a belief in the kind of work we wanted to do. But when it came down to the details, he's much more of a minimalist than I am. I like things a bit more fussed up. He likes things absolutely stripped down. Massimo and Layla really did a number on him. I mean, he's still that person, and it really goes along with his own sensibility. It is his sensibility. But what I found is that in life, like in everything else, we found a way to give each other space to do our own thing, which is why we rarely share a client. We've almost never shared a client. And we found, Nancye Green was really, we did the kind of work we love to do, which is really intensely content rich. Whether it was designing an expert system or doing a museum exhibition, we were always interested in the thinking, the ideas, and like that. But I actually like the process a lot more than he does. He sort of would like to go off and design it. I really like the collaboration part of it a lot. And I really liked working with designers in the office who were really talented, and they would do a lot of the design work, and I was much more involved in the process and the thinking and the setting up of the ideas, and not as much involved with designing the case. Whereas he loved designing the case and making sure that it was all, perfect. So we found a way to give each other room to be different and to not always agree, but to really share the same values. If we didn't want a client, we almost 99% of the time agreed on it. And when we decided to go off and do our own work and to decide to become a bit of an incubator for projects, we always agreed on the kinds of projects that we wanted to do. They had to be interesting because we both had to put our own money into them. So we've been pretty collaborative all the way along. Then we had children, by the way. We have 2 children. And that really that was the stress test, much more than the design office. So, you know, I think raising children together is very hard on couples and on marriages because, you know, it seems like that is just a natural thing to do, but it doesn't come that naturally to, it doesn't come that, you have to agree on a lot of things. From bedtime to curfews, you know. Nancy, they're out till 2 o'clock in the morning. You have to talk to them. That kind of thing. Question? Yes.
Can you talk about the learning curve of working in healthcare? There's a lot of puzzle pieces of like payers and all of that, but kind of what were the biggest shocks from going to healthcare?
Well, I feel like I learn every day different kinds of things. I know just enough to be dangerous, but not enough to really be well equipped. We get involved, there's the whole delivering drugs into the marketplace part, the commercialization part, and that's where the payers come in. There's the whole, I'll start at the very beginning, okay, and move all the way to the payers, because they're the end of the line. There is the science, and really understanding the science, understanding what the science can do, and deciding that something can actually make something that would be good for human beings. So there's a whole process that goes into figuring that out, both you know, not in humans and then ultimately in humans. So when it gets to humans, and there's a whole thing around the design of scientific trials, dealing with the FDA, getting protocols approved, negotiating with the FDA for something, and at the same time beginning to understand if you can actually bring it in for a value that the healthcare system can afford and will pay for. And that used to be much further down the line. Now that's earlier down the line. That's why a lot of companies aren't doing a lot of R&Ds, because they get nervous at that part. Like if it costs a lot of money and it's not a cancer orphan drug, will anyone pay for it? So a lot of the issues you see, infectious disease problems that you all have heard about in the press, you know, antibiotic resistance, drug companies won't develop antibiotic resistant drugs because they can't charge enough for them. Anyway, that's a whole other story. So there's all that value. Can this drug deliver value to patients and value to the healthcare system? And will payers pay for it? Then there's, can we convince doctors? You know, is it good for patients? And this is now we're getting closer to commercialization. Can we convince doctors or healthcare systems that they should buy it? Why wouldn't they if it at the right price and it will deliver value? Well, because it's hard to change a protocol. It's hard to change the way people do something. So we had a really incredible pain management thing, right? So it's a little computer that sits on a patient's arm that carries fentanyl. And when a patient is post-surgical and they're conscious, they can actually press a button and get just the right amount of fentanyl to take their pain away. And that's really great because they're not connected to wires. That means they can do rehab because it's just sitting on their arm. They're in control, and so on. Well, guess what? The hospital has to institute a whole bunch of different systems to manage this product that is different from this big, bulky thing, you know, IV lines and everything that sits next to a patient bed. And it's more cost effective, it's better for the patient, it's better for the process, it's better for the healthcare system, but it means retraining patients. And if doctors are going to have to, if hospitals are going to have to retrain caregivers to give it, they just as soon not. Because they don't care if it's better for patients and that it's less, okay? So you have all that part. Then you have the part of, then you get all the way to, okay, we have a therapy and there's a system of care that we're going to have to build around it. So like with us, we're considering, should we hire 40,000? Well, there's now a company in Northern California, of course, called IGBO, I-G-G-B-O. I don't know if you've heard of it, but they're the Uber of nurses. So they hire nurses by the hour to deliver services to people in their homes. And it's very cost efficient, and it's a really great solution to lots of problems. So should we work with IGBO, for example, And should we hire 40,000 nurses, you know, a fungible workforce around the country to go to people's homes and deliver them this shot so that we can make sure patients get it? I mean, these are all the considerations. It's not just, is the drug safe and effective? That's the molecule to begin with. By the way, this is built, our drug is built on a brand new platform called RNA interference that someone got a Nobel Prize for. This is the first big drug to come out in this new platform. So first of all, is the platform safe and effective? Will the FDA approve it? What will we have to do to get them to approve it? Do they believe that PCSK9 knockdown, that's the protein that's actually inhibited in the liver, does the FDA believe that that's really a proxy for getting rid of LDL? And so we have to get through all that. Then, you know, can we figure out how to get it to patients? Then can we figure out how to get them to take it? And can we get payers to pay for it? Even if it's cheap, it's not as cheap as statins, which you have to take every day, which cost nothing. So the next platform that came out before ours was one called monoclonal antibodies. They're $17,000 a year, and payers have refused to pay for it. So ours will be $2,500 a shot. If you're 40 years old with high LDL, you probably can take one shot a year, so it's $2,500. That's still not nothing. Can we get payers to pay $2,500? Not $14,000, but $2,500. I don't know. That's really cheap for a brand new drug, but we may not be able to get them to do it. So all these considerations. So you ask about working in a pharmaceutical company. Every part of this journey has a whole set of professionals, language, capabilities, business models, science. It's all, you know, every single part of it is a little different. So frankly, if you're around it enough every day, you pick up some. But I really think that the systems problem to be solved is not rocket science. You know, the parsing of the problem, which I just kind of laid out for you, you would get that in a minute. The specific language around, I mean, I still am saying, what does that acronym stand for? You know, you learn the terminology of some things pretty quickly because you learn anything pretty quickly, but then you always feel like there's another whole thread that I've never heard of before. You know, and it's not my job, but I need to know just enough about it so that if I'm thinking about how are we going to manage that part into the equation, I can be smart enough. So I think that any of these areas, if you work in them for a while, and I don't mean years, if you work in them for a while, you pick it up. I mean, that would be true if you're working in coal technology, or, I mean, Cheryl and I were looking at something recently, and I remember reading the prospectus thinking, I don't understand any of this. And I know that if I spent a year in it, or 2 years in it, immersing myself, I would know as much as I probably know about the healthcare system. I think a lot of this is what motivates you.
Speaking of that, I don't know how, this is going to be a half question and half comment. So you and I have known each other for many years. Mm-hmm. And one of the most remarkable things about you, and hearing you talk about this, right, because I've been present. In fact, I think we were in a cab together when Clive emailed you because we were coming back from TED. One of the things we talk about a lot is a sense of agency, right? You are not only, you see opportunities where people don't. You are sort of relentlessly optimistic when you get in the middle of things, and you like to take on the gnarliest problems of anyone I know. But this sense of, was there a point at which you began to believe that you could do anything, and so you could just wade into these things, and one way or the other you would learn the acronyms, you would understand the system? Was that a moment in your life?
It's a good question. Well, I'm an Army brat, so I moved every 3 years of my life. So I think that my sense of being thrown off the deep end into the deep end of the pool has been my life experience, and I think that's helpful. I really do, because I think that if you have to negotiate new environments a lot, you learn that they don't kill you. You know, you may not always like them, but it doesn't kill you. I think in terms of agency, it's so interesting you said that, because Clive Meanwell, the guy who's the CEO who hired me, his biggest criticism of me, which he tells me on a regular basis, is that, that I don't act like I own the joint. And he said, I trust you in your instincts more than anybody. Why don't you just act that way? And it is funny because I have a push-pull with it. You know, I think as designers, we always feel like we're really not entitled to have our own opinions in rooms of experts. Because, I mean, that guy did that his whole life. You know, he's been a bench scientist for 45 years. How can I say, I don't know if that's the best way to do that, right? And it is, I think that it is a little scary sometimes when you're sitting in the room, and I find I still have this moment where I say, I should really speak up here because I have a feeling I do know the answer to this. Well, do I really know the answer to this? I mean, is there something I'm missing because I don't know enough? And there's always that push-pull between confidence and agency and feeling like you've done enough, you've thought about enough things, you've thought around enough things that you have something to offer to the situation, but I'm not the deep expert. And as designers, we're always dealing with that because we're never the deep experts, or rarely.
But that's a little different from your own confidence about what you can do, whether you're talking about it in any situation.
Yeah, I think that the issue of saying, if I dive into this thing, I'm going to figure it out one way or another. And I do think that you get more confidence the more you've done it. And I think the thing to do is to not hold back. I think like anything else, it's a muscle you develop. So that it's always good to start off with little risks before you take big ones. I mean, not to be, you know, too obvious about this, but I think that Michael and I started off, you know, we had the Vignellis, who Michael had worked with and was mentored by. Then we worked with the Eames office in our first year of being in business, and it was scary because Charles and Ray Eames were so amazing, a force to be reckoned with. They were IBM's. Everything that you did for IBM had to be run by Charles and Ray Eames, so that's why we were running all of our ideas by them at our second year in business. But I think that one of the things that happened early on is that we got things that were really scary to do. They were almost too exciting to pass up. They were too scary to do. So you go back and forth saying, am I too scared to do it? Am I too excited not to do it? You know, and usually what happens with most of us, I think, is we say, oh well, you know, I'll figure it out. And so there was a lot of that, and I think that the more you exercise that muscle, the more confidence you get that you've done it 2 times before, 10 times before, 15 times before, you've been in deep water, you've figured your way out of it, that you will do it. And I have to say, the stuff that you're trying to do, knowing what you guys are here for, no one's ever done it. That's what we keep saying to ourselves at the medicines company. What we're trying to do, which is a huge clinical trial with lots of people for very little money, that gets approved by the FDA, that gets to patients for a very low price. No one's ever done that before. No one has ever done that before. So when everyone says, can you do this? Say, I don't know. I mean, no one's ever done it before, but what's worth doing unless you're trying to do something really important and purposeful that no one's ever done before? Otherwise, go design logos, right? I mean, you can do 100 of those. I remember when one of the offices we had, we expanded and we sublet our office to someone who did annual reports. And he did them, that's what he did. He did them from the beginning of time, you know what I'm talking about, he did them till the end of his life, annual reports. And Michael and I looked at each other and said, oh my heavens, there but for the grace of God go we. You know, we always wanted to do stuff that we'd never done. Michael would always say, if you've done 3 of something, you're an expert and you don't want to do it again. And I think that this issue of trying to always challenge yourself to take all the skills and capability you have to do something that you think is really worth doing that you've never done before. The worth doing is for others, the never having done before is for me, because I get to figure it out.
I have a question about instinct and intuition that you were talking about earlier, and how you navigate that. And it's something I've been thinking about recently, and how do you communicate that maybe in a space where, how do I feel? Okay, so you're trying to get from A to B.
Mm-hmm.
You can get from A to B like with a formula, or you can get from A to B with a chart, or you can get from A to B with a picture, and you get from A to B with intuition, maybe your instinct. And how do you make that, how do you communicate that in a way that you can get?
That's a really good question. I think the most important thing we have is the part of our brains that is the most valuable to us is the part that is the least articulate in words we can explain. And I think that one has to cultivate it, protect it, and trust it. And that, I mean, whatever practice one does with mindfulness, meditation, whatever it is that gets you to that place where you kind of know what you believe, what you feel, and you don't know if it's right or wrong, but if it's right for you, and you feel it, you know, you've put in all this data and all this experience, and then your gut has to guide you. I mean, there's just no other way that these hard things get done, is that because there are no formulas. There's no right way to do something that someone hasn't tried to do before. So you have to dig deep and find the path within yourself. I think that the way you bring others along is you backtrack. I mean, that's the way we've always done it, is that you find the path forward through something that maybe there's lots of input that goes into that. It doesn't mean that you just go in the closet and you say, what should I do? It's a lot of talking to people, a lot of intake of, depending on what it is, data, other people's experiences, whatever it is you think you need to be informed by. But then you do have to go away and say, now I'm going to have to feel my way through this. And I think the next step is this. Now I'm going to go back and I'm going to build a bridge back to explain to others how I got here. And you can't, I think, we spend a lot of energy, Michael and I have always agreed on this, spend a lot of energy doing that backtracking so that we could bring people with us. Because it's hard to say to people, look, I've done all the research, I've listened to all of you, now I believe this, trust me. You know, I think you have to, you know, I remember the first time someone explained to me that learning and teaching was about taking people from here to here, one step at a time. You know, you can't take people from here to there. And I think respecting other people enough, even if you don't agree with them, to try to build from their experience to your belief and understanding is a part of what we learn to do as designers who convince others. I don't know, what do you think?
I absolutely think that. I think because also I think of it as subconscious, and that's where ideas always come from.
Mm-hmm.
And I don't often know the logic, but it always happens that you know where you want to go, and then you back up and you make it logical for yourself, and you make it clear. You know, you build the stepping stones for other people. Yeah.
Mm-hmm. I mean, as people who want to change the world, you know, you have to get the world to come along with you willingly. No, I mean, the kind of people who want to change the world and bring them kicking and screaming are not the kind of people who are sitting in this room trying to change the world, right? Exactly. I wasn't going to say it, but so I think that we have to learn to think, you know, in all directions, and you have to learn to trust your instincts, but you have to help people get to where you are. And part of the success is, I think a big measure of success is your willingness and ability to be empathic with the people you're trying to bring along. I mean, empathy it's so underrated. It's the most underrated thing in the whole world. You have to have empathy for the people you're designing for, and empathy for the people you're trying to collaborate with, and empathy for the people you're trying to convince. I mean, you just have to like get into that boat and bring everybody along with you. These are great questions. Does anyone have? Yes.
Second question.
Good.
So in this side, especially within healthcare or social impact or things like that, where you're hoping that everyone's in it for kind of greater cause and greater good. Have you had experiences where you're dealing with maybe designers, maybe others, where kind of ego gets in the way of that, and how have you dealt with that?
I wish the ego were the biggest problem. I really think that people aren't in it for the greater good too much of the time. And those people who aren't in it for the greater good have a lot of power. And that's my biggest frustration. It isn't even so much the egos. I mean, egos are frustrating and irritating, but it's even worse that people really believe that that it is. I'll give you a perfect example of what makes me crazy. I was doing a preceptorship, which is a learning journey, learning 3 days in a hospital, and we were looking at this pain patch, which is really good for people who have specific kinds of surgery, particularly anything colorectal, or it's really helpful for that. So we were looking at patients who'd come through surgery and looking at how they were recovering in the recovery room. Again, empathy, trying to figure out, like, how does this thing really work and how do we explain it to them? And at the end of the preceptorship, we're in the classroom, and various people from the hospital are moving through, you know, the chief financial officer and this and that. And so the head of nursing, or something like that, she was a nurse, but I'm not sure that was her job, moved through, and she said, the most frustrating thing today is that instead of spending money designing better ways to deliver services to patients, we're spending our money hiring MBAs so we can prove to the government that we have delivered the healthcare service that has value so that they'll pay us for the work we did. So last month we hired 10 MBAs, not 10 social workers, not 10 healthcare workers, not 10 new pieces of equipment, not 10 anything. We hired 10 MBAs who can sit in the back room and write forms for the federal government. So I think that what frustrates me most about the system is I don't believe that the system today is really set up to serve the interests of the greater good. Because if you're really trying to deliver health to a population, what would you be looking at? You would be looking at illness. You'd be looking at the biggest illnesses. You'd be looking at obesity and diabetes and heart disease and HIV and all these, and then you would think about, so how can I best deliver solutions, a total care pathway to those patients and their families, Alzheimer's, dementia, the elderly. How would I deliver healthcare services to those? And I would design a healthcare system from the patient out. You wouldn't say the most important thing the hospital can do is prove to the federal government that they had fewer readmissions so that they can get the full cost of that service delivered into their coffers. So that's what, I think that's what frustrates me, is I think the system is so parsed, you know, that people who go into medicine for good reasons end up not necessarily doing what they want to do and not delivering. They're very frustrated because they're not delivering services the way they know they should be delivered. So in healthcare in particular, I think that's more frustrating than egos. Yes, there are a lot of egos at the same time. But, you know, in anything that any of you are trying to do, any theses you're trying to write, I'm sure the thing you've stumbled on is that the systems aren't being designed to deliver whatever it is you're thinking should be delivered in the best way possible, whether it's food or education. It just feels like the wrong boxes are being counted or being checked.
I have another question.
Sure.
I'm just, my personal, right now I'm concerning is the way of telling your issue, your social problem. And I was wondering, what do you think about the shortage of the storytelling? Because for me, yeah, everybody loves story. I love the interest story. It's very attractive and draw attention. But I kind of sense it's not telling the whole story, just telling the part could draw the interest, not tell the not. I just mean not being enough informative about the issue. I want to say it out. Do you know what I mean? Like,
Yes, I do.
complicated.
I do. I think storytelling is probably the most important thing on the planet. I do. I mean, that's when I said build a story from, you know, you have this project and you see the path and you've done all your research and you've interviewed all your people and you've lived in their world and you now have decided this is what I have to put together. And then you go back and you build the story, what Cheryl was talking about, from your subconscious. You know, you build the story for yourself so you understand it, then you bring others along. I think what's missing, if you'll bear with me for a minute, is there are stories that are emotional and that really tug at your heartstrings. And there's data that is factual. And I think what's really powerful is when you can put the two together. You know, and you can tell a story that is meaningful, powerful, emotional, and is humanly accessible. But at the same time, you do it, if possible, in a dispassionate, qualitative way, if you know what I mean. Because I think what happens is that people discount stories that are purely emotional. The people on this other side, you know, those idiots who are sitting in the back room trying to just add up the ledger sheets, they say, oh, those people, they're so emotional. Of course, I can tell you a patient story every day that will, you know, pluck at your heartstrings. But I think that one of the things that we've tried to do at the Medicines Company, and that Clive, meanwhile, that guy who's the CEO, is a fascinating guy. MD, PhD, English, oncologist, but he is probably the best communicator I have ever known in my life. I mean, if he gets up in front of an audience of any kind, doctors, patients, families, shareholders, I mean, you're just kind of putty in his hands. And the thing that's so incredible about him is that he goes back and forth between the human story, even the humor in the human story, and the data, so that you really connect, you know, what is really happening in the world to the humanity of that event. And I think that it's a talent, but I think it's also a skill that can be acquired. And I think if we could all acquire the skill of being very grounded in what we know, evidence-based, which is what science is all about, and yet not separated from the human stories that are involved in the evidence base, I think that's where the power really lies. I mean, that's why I think documentary filmmaking can be so powerful, particularly if you connect, you know, if you can connect all those dots. It's not easy, but it's doable. And it's very important when you're trying to sell an idea, is to connect with people on a gut level, but also, you know, give them the evidence that the idea is grounded in facts.
All right, well, thank you, ma'am.
You're very welcome. Good luck to all of you, and particularly you second-year students.